Okay. Which of the following radiographic findings is most likely to be seen in this patient's knees? Ankylosis, bilateral sacroiliitis, joint space narrowing, periarticular osteopenia, or subchondral cysts. A 65-year-old woman presents to the clinic with a 6-month history of progressively worsening pain in her knees, particularly after prolonged periods of walking or standing. She reports that the pain is relieved with rest. On physical examination, her knees show bony enlargements with crepitus on movement. Which of the following radiographic findings is most likely to be seen on this patient's knees? Okay, every time I see an older lady who has like any type of joint issue, I always go to the two diagnoses of rather just osteoarthritis or rheumatoid arthritis. And the
Good.
difference that I kind of go with initially is just when they get worse and when they get better.
Yep.
And osteoarthritis gets worse with movement. And so you walking and standing all day would make it worse versus rheumatoid arthritis. People tend to say like, I just have to get warmed up and then I'm good.
Yep.
So I think this is osteoarthritis.
Okay.
Now it's going down to here. I don't think it's ankylosis or bilateral sacroiliitis. Um, I, I, I was lost. I feel like it's between joint space narrowing or periarticular osteopenia. It could be subchondral cysts. I don't think it is. Periarticular osteopenia or joint space narrowing. I'm gonna go with joint space narrowing.
Okay.
I could be wrong. I don't know. I don't think it's subchondral cysts
Okay.
and periarticular osteopenia. It could be that. I don't know.
Okay.
I just know that like you have, sorry, go ahead.
So I was gonna say, right? So your gut answer choice is C. Do you have a good reason to change it, right? So always think to yourself, all right? Do you have a good reason to change it?
I I don't have a good reason to change it, no, but I don't know if it's right. So I would say.
Okay. So final answer is C then, right?
Yeah, I'll go with C.
Yeah, you get a little joint space narrowing with osteoarthritis for sure. Okay. Um, so osteophytes, formation, joint space narrowing, subchondral sclerosis, but not cyst, right?
That was the word I was thinking. Like, I know it's something with subchondral.
Yep, yep. So, cyst, layer of the bone beneath the cartilage of the joint. But joint space narrowing is more common characteristics and common findings in the condition, right? But you get more sclerosis than cyst. And then periarticular osteopenia, decreased bone density around joint is not a typical finding of osteoarthritis, more commonly seen with inflammatory arthritis, such as rheumatoid arthritis. So yeah, so remember, one of the reasons why I kind of want to go through that with you is I want you to be thinking, um, I want you to be thinking to yourself, if I don't have a good reason to change it, then don't change it. And so
Yeah.
it's a huge key test taking strategy, especially if you're somebody who's always like, oh, I keep getting these 50-50s. You initially get the right one, and then all of a sudden you change it, right? So
Yeah. Yeah.